Thanks so much for joining us for Impact State of Mind. My name is John Paul Parmigiani. I'm co-founder and CEO of Impact Hub New York Metropolitan area.
So thank you so much for joining for today's session, which is Ghana's health innovation landscape and COVID-19 response. This is a deep dive with the African Health Innovation Center, and we are supremely honored to have today two of the co-founders from the African Health Innovation Center based in Accra, Ghana. Emily Sheldon, CEO and co-founder, and Freda, who is co-founder and design lead for the African Health Innovation Center. It is such an honor and a privilege to have you on our program.
Thanks so much for having us, JP.
Great. I thought maybe you guys could start us off by telling us a little bit about the African Health Innovation Center, what your goals are, what your mission is, and in general, the work that you guys do.
Yeah, thanks so much for having us here, for hosting this series, and for putting a spotlight on innovation in Ghana and on our health ecosystem, because I think it's a really exciting topic. So as you mentioned, my name is Emily Sheldon. I'm the co-founder and CEO for the African Health Innovation Center. And this organization actually started in 2016 in collaboration with John Paul Parmigiani when he was wearing a different hat, working with Impact Hub Accra. And we decided to create something brand new, a health innovation program within Impact Hub Accra that brought a focus to ongoing health issues and challenges and opportunities for innovation within an already existing innovation hub and entrepreneurship center. We kicked off with an event called Health Hack Accra, which was the first health innovation focused hackathon to take place in West Africa, and slowly built up ongoing programming, including incubators, research programs, until 2019, when we spun off and became our own separate organization, the African Health Innovation Center. So we're located in Accra's Osu neighborhood, and we spend about half of our time working directly with entrepreneurs, with investors, working within the innovation ecosystem. And we spend the other half of our time working with more traditional organizations, the government, hospitals, NGOs, to try to introduce them to innovative thinking and entrepreneurship as a technique to improve more traditional forms of healthcare and public health service. So our team we come from really wide backgrounds, from public health, from engineering, from customer service, and we try to bring those diverse skills together to create a conversation and kind of serve as a center point for all of the different parties that need to be involved to truly improve health. Right now, our big goal is focused on opening a physical space where we can offer training programs and community health opportunities. And long-term, we really want to open a multi-million-dollar innovation hub fully focused around health, with everything from a maker space to a simulation center to really help create Accra and Ghana and the African continent as an epicenter for the health innovation conversation.
That's amazing. I'm so excited for you two as you continue this work. So I was wondering if maybe you could tell us a little bit about the health issues right now that are facing Ghana and the region, and maybe do so without touching yet on COVID-19. I know we'll address that in a bit.
Sure. So, I mean, Ghana, Accra, West Africa, all of these different areas are facing significant health challenges. And there are things that we see every single day. A lot of the world is really familiar with infectious disease. That's the category that we would think of. That's things like malaria, tuberculosis, HIV. West Africa actually has relatively low HIV rates for the African continent, but issues like malaria can be deadly to a lot of the community. And when you think about this from an American perspective, people kind of treat malaria like the flu in the US. You get it kind of frequently, you get it often, you don't think much about it. But if it's not treated well and it's not treated appropriately, it can turn into something that becomes deadly overnight. And so that's a really big focus area for a lot of people in Ghana. However, we know the really big emerging health issues are a category that we call non-communicable diseases. This is things like diabetes, hypertension, lifestyle diseases in a lot of ways. In fact, it's been estimated that over 18% of the Ghanaian population is diabetic. So we can see that the food we eat, how we engage with the world, our level of physical activity is all going to be really relevant in treating those conditions. We also know that there needs to be a stronger focus on both emergency care and primary care. One of the challenges we see not only in Ghana, but throughout the African continent is that instead of having tiers of care, a lot of times everyone goes to the hospital for everything, whether it's a runny nose or your arm's just been dislocated in a traffic accident. And what that means is all of these different challenges are going to one place that's trying to triage and deal with everything at once. So having a larger focus on primary care, where people go to see a specific doctor that follows their care over time and is able to tell them when things look abnormal or off for them specifically, as well as emergency care, access to blood when it's needed for transfusions, access to ambulances, making sure that there's a bed available and a trained provider if you're in an emergency or need surgery. These are really, really big areas of focus for the African continent as a whole, and especially in Ghana, that have a lot of room for innovation.
So how has Ghana fared during COVID-19 crisis? What has the African Health Innovation Center been doing to meet the challenge and use resources to help people out during this time?
Sure, maybe I can start this one talking a little bit about the government's response, and then Freda, maybe you want to share more about what's happening on the ground now. For anyone who's watching, I've been based in Ghana for the past 4 years, but I'm currently in the United States because I had a baby earlier this year and came home to do it at my home hospital. So Freda's actually on the ground in the situation right now and can really share that perspective. From an overall government perspective, the Ghanaian government actually had a pretty strong response to COVID-19. One evening in mid-March, the 2 initial cases were announced, and it was the following day that the Ghana government made the decision to temporarily shut down schools, which still have not reopened, to place a ban on public gatherings, and to start placing limitations and more strict testing on incoming flights. That ultimately led into a complete travel ban, which is still in place now, and also to a lockdown, which lasted for about 3 weeks, where all Ghanaians within the major regions, the major cities, were encouraged to stay home, along with public campaigns about hand washing and mask wearing. A lot of that has actually loosened up over time. And Freda can speak more to that. The mask rules are still in effect, but a lot of Ghanaians have essentially returned to normal. We know that overall, Ghana has a fairly high case rate for the African continent, but not in comparison to the rest of the world. The current numbers are that there have been 43,260 cases that have tested positive, and of those, 1,723 are active, which means that over 41,000 have recovered, and they've had about 261 confirmed deaths. We know a couple of things from this situation that are relevant for COVID in Ghana. One is we do have to recognize that Ghana has a system that has challenges sometimes with appropriately recording deaths and recording cases. So while we keep these numbers as a barometer for whether things are getting better or worse, we should also take these numbers with a grain of salt. We should know that they might not be completely accurate, and some areas might be getting less testing, or things might be not recorded 100% correct. However, we do know that Ghana has a lower incidence rate, meaning the number of cases, than we originally expected, but most importantly, they have a lower severity rate. While we see cases happening in Ghana, we don't see them getting as serious as they did in Italy, or they did in Spain, or they are right now in America. We see fewer Ghanaians that are required to go on ventilators and fewer that need really significant ICU care. We don't know what this means right now because we don't know the long-term effects of COVID, right? Are we going to have less severe cases, but then more long-term issues? We don't know. And that's why we as AHIC encourage everyone to be really cautious. But it is important to note, and a lot of research is going into the fact that right now the African continent seems to be much more resilient to COVID than other parts of the world. Freda, do you want to share more about what the situation looks like right now?
Yeah, exactly. I think Emily covered a lot of it in terms of kind of the broader picture and how both the government and other actors are responding to COVID. The silver lining or the bright side in all of this is that we have seen a lot of innovation and resilience across different sectors coming through either PPEs, personal protective equipment. It's just kind of innovators kind of came out of anywhere and everywhere and came up with a lot of different things. In terms of PPEs, we've seen young people come up with things like touchless taps, 3D printed parts for ventilators. We've seen academia jump in the mix. Academic City, one of the universities here in Accra, piloted a ventilator. I've seen young people, kind of pivot. I had one particular young man who was making eco gels from alcohol, right? And decided to pivot and turn that into hand sanitizer. So there's been a lot of that in even established firms, especially a lot of tech. So we've seen telemedicine being piloted by a number of different organizations within AHIC's own cohort with the UNICEF Startup Lab. The Lafayette Innovators is home mobile nurse. We've seen others. We've seen organizations in agribusiness like Farmerline and Cow Tribe use their existing mobile communication networks to connect with farmers and those in rural areas. Even surprisingly, the government of Ghana, I shouldn't say surprisingly, but surprisingly, has come up with, I was pleasantly surprised to see a WhatsApp chat bot during COVID times where people could log in and ask questions along with data tracking. There's an organization that works closely with HIC called Redbird, who does a lot of analytics and testing in the pharmaceutical value chain. And they came up with something, some testing protocols online that people could also use. So, on the bright side, there have been a number of interesting innovations from the tech scene. But also, I guess we could also say the government, from a policy angle, has also tried to mitigate the impact of COVID-19, both with stimulus packages for small businesses, as well as interventions for infrastructure, like electricity and water bills that were put away for a few months, for about 3 months or so. So, and of course, I can't neglect the University of Ghana, which was really instrumental and led the way in sequencing the virus. So, on the bright side, we've had a lot of different activities and a lot of different people stepped up to the plate, which was a really, really good thing to see.
I'm wondering if you could maybe elaborate more on the sentiment on the ground in Accra, right? How are people feeling about COVID-19 in general? Are people afraid about it? Are they brushing it off? I know that Ghana's population is a lot younger than our population here in the U.S., which maybe also gives that extra confidence factor that we'll get over this. But how are people internalizing it?
Well, if I'm being honest, people are definitely brushing it off. A majority of people are like Emily said, are acting as if the virus is a thing of the past and we're back to normal. So that presents a challenge, obviously, because we're not in the clear yet. I guess I could say that, you know, part of it is because a lot of the incidences of the virus have not been so severe. And so,
I can briefly share, you know, I think something that's really important for us to look at from a health perspective in this. Everyone did the right thing, which is when we saw COVID getting stronger and stronger and more serious in other countries around the world, the Ghanaian government shut down early, they put restrictions into place early, and they told everyone to take this really seriously. When the same level of challenge didn't happen in Ghana, first of all, that's a sign that public health measures are working, right? If you shut down earlier, if you're smart about it earlier, you should have fewer cases. One of the challenging things about public health is that if we do our job correctly, it looks like we overreacted, right? But also we saw that sometimes the cases weren't as severe. What's important for us to recognize now is that our knowledge about COVID is changing dramatically every single day. We're extremely lucky that so many researchers and scientists around the world, every major academic institution, every major biomedical institution, every major health institution is focused on this right now, which means we're learning at a faster rate. One of the things we're learning in higher income countries right now, more developed economies, is that COVID-19 has significant after effects. If you get this virus, even if it's not severe, you could be suffering from really severe respiratory issues, challenges with breathing. We're seeing strokes happen in relatively young people for months, or we don't even know how long after the situation is resolved. Now, we don't know if that's happening in Ghana yet, right? And if it does happen in Ghana, that could place an additional burden on the health system, and it would be harder to identify because, like we talked about earlier, people don't go to the hospital or to a primary care physician the same way. So right now, we really want to be hopeful about the lower incidence and severity rates, but we also really need to be cautious. And that's why this return to normal so quickly is challenging, because we don't know the long-term effects of what's going to happen to our bodies or our health systems as a result of this. And so erring on the side of caution until we figure it out a little bit more is important, but it's been harder to explain, especially in an area where you have a hand-to-mouth economy, where people have to go out and work that day to be able to eat that night. And the economic impact in a country like Ghana is so severe and so significant. Freda, are you back? Anything else you want to add? Sorry, I jumped in there.
Sorry about that. You know, Data. This is Ghana. So what I was saying is that on the flip side, I have been really encouraged by the sort of what the government has been trying to put in place, the different interventions and the different requirements. So for instance, it's very common to go into any small business and see posted on the sign, no mask, no entry. Okay. And for most part, people do adhere to that. So been to the grocery store, been to the pharmacy, been to, you know, different established small businesses and actually see people wearing masks. It's different if you're walking around on the market. On the flip side, things are not, you know, as much as controlled, of course. We also see the government putting in place various regulations around social distancing, the number of people who can be gathered at a certain place and time. Of course, it was much stricter in March and has been eased systematically. We've had some difficulties around, you know, students going back to school. You know, on the bright side, we see the government trying to pace it, as in not everyone was allowed to go to school at the same time. It was just a few students, those taking exams. However, you still see that it's necessary. It's not foolproof, just like everywhere else in the world. And so we're having to go back and see how best to enforce some of these measures that have been put in place. So the issue is really not that they're not in place, but really enforcing them, I think, just as it is around many countries around the world.
Got it. So before we continue, I just want to mention to audience members that we're happy to answer your questions here today. So if you have any questions, you're welcome to put them in the chat or the Q&A so that we can make sure that's answered before the end of the event. But my next question is getting back to the African Health Innovation Center. Can you expand a little bit more on, like what your involvement has been, during the crisis and what you see other touch points of how you guys can support fighting the crisis?
Yeah, why don't I start, and then Freda, we can go to you. Does that work? So what I want to talk about is, AHIC is a public health organization, but we're also a startup ourselves. And so this impact on small businesses and small organizations, as well as kind of the health component, has been really relevant for us. So one of the things that we've done is, not only is AHIC trying to play a role in educating people and creating connections, and maybe Freda can share more about some of the brainstorming we've been doing with other innovation groups and more about the webpage that we've placed on our website. But we've also had to figure out how to manage this as an organization ourselves. So, we made the decision as a public health organization, the day that the first cases were confirmed in Ghana, to switch to a completely remote work system. And that's not as simple as telling everyone to work from home. We have power shortages, we have challenges with paying for data and for Wi-Fi. So for us, this has really been about creating an understanding environment. So we've made an announcement that our employees will work from home. We have provided financial support to pay for Wi-Fi in our team's homes so that that's not a burden that they have to bear. If there is an instance where our team needs to travel somewhere, AHIC covers the cost to go in Uber, so they're not having to go on public transport. And we've really tried to do what we can to be supportive. So, sometimes we have a team meeting and somebody's lights are out. We would say the electricity is out. So we find ways to accommodate and share notes with them later. Everyone on our team is doing their best. And from an administrative perspective, we have to be really understanding that sometimes it's really challenging to work from home as opposed to just convenient. The second thing that we've done is we reached out to all of our partners proactively. We informed all of our funding partners that we were making the decision to work remotely and that we were happy to continue on our projects, but we needed to transition them remotely. And we did that by presenting a transition plan to each of our partners, looking at the deliverables that we had in upcoming months, and then shifting them for how we wanted to deliver them online. From there, we took feedback and we started implementing. So for us, we've had this whole kind of administrative burden of figuring out how do we keep doing our work while adhering to public health principles. And in addition to that, we've tried to figure out how do we play a leading role in helping with the conversation. Freda's been kind of on the ground for that. Do you want to share more about that?
Yeah, sure. So, and when Corona finally became a reality in Ghana, I think, as I mentioned, a lot of people were sort of concerned, and rightly so. But also what we saw in the innovation community is that a lot of people began to just, okay, let's go. What do we do about this? Jump in. How do we help? So AHIC was part of a group that we started called Solve Corona GH, where we brought together a number of different innovators and organizations. We had tech people, we had journalists, we had students, all in this kind of WhatsApp group trying to solve Corona, coming up with a number of different ideas and just supporting each other. We actually formed a coalition to try and get government support on some of the initiatives, although unfortunately we weren't able to get as much support as we wanted because it was a crazy time, but we were able to put out some of these and prototype some of these interventions, such as the COVID tracker. There was an Ushahidi app that was created for tracking different incidences of COVID-19, that was put forth for different competitions and so on and so forth. So really what we tried to do was garner a lot of innovation stakeholders within this group to begin implementing some of these ideas. And that was a great opportunity for us. We also had the opportunity to just interact and engage with some of the innovators who were in our program. Also just learning from what they have been doing. We also put together on our website a list of existing interventions, resources, links that others could just go to and connect and just find out what else was going on. So yeah, we were kind of a hinge point, so to speak, brainstorming some of our own ideas, connecting with others. I had people, working on different things, contacting me. Where do I get parts? How do I 3D print? And being the connection point for some of these people. So it was very much all hands on deck, and it was a great opportunity.
Very interesting, and it's great to hear that you guys have been leading the charge in trying to get people to collaborate to take steps to move forward and solve some of these problems. You mentioned earlier some of the trends, some of the health innovations that are coming out of Ghana. I was wondering if you two could maybe expand and give our audience more of a flavor of the health innovation landscape in total, and what are some of the movers and shakers that they should pay attention to?
So Ghana has quite a few. We're still coming up, but I can think of a few that I think we could definitely pay attention to. So I've already mentioned Redbird, the reporting app. Another one that I would throw out there is Incas Diagnostics. So Incas Diagnostics came out with a diagnostic testing kit. I'm going to leave Emily to explain the health, the health part of that, because I know there's two types of testing kits, and I forget the difference between the one that he did, the PHP or PCB versus the other one. But it was the first in Ghana that we had seen that was homegrown, and he has Lord Basing has come up with a number of different testing and diagnostic tools as well. Another one, I mentioned home mobile nurses already. There are a few other telemedicine companies out there as well. You have Pharma, which is in more pharmaceuticals and getting medicines accessible to anyone from their mobile phone. So there are quite a few. Do you have any others to add to the list that I missed?
I mean, I think those are great examples. One of the things that we've seen is that there's been this really big resurgence of this focus on entrepreneurship and innovation in Ghana over the last 5 to 10 years, right? If we went back to 2015, there were a small handful of entrepreneurship support organizations, and now they're everywhere. We see so many people wanting to launch startups, wanting to join training programs, and wanting to get engaged. And while health used to be kind of a smaller focus area, right, it has additional challenges. There's higher risk associated with it. There's different vocabulary and education and knowledge that's needed. It can be really hard to access if you don't have some form of training and health background already. We saw that a lot of people wanted to do health. They felt driven by it. They often had a personal story that made them want to solve that problem, but there wasn't really an avenue for them to learn more. And as different opportunities, different training programs have arisen in the last 5 years, we've seen the number of health startups grow, which means we have a lot of health startups that are at the earlier stage level because they've started in the last few years as they've gotten this kind of motivation paired with actual technical support, and now they're getting ready. So, you know, Home Mobile Nurse, which Freda talked about, some other startups that that AHIC works with would be Verify, which is doing sexually transmitted infection testing using rapid point of care diagnostics. That's what we're talking about, which means you get kind of a test result. They also have tests that can take a longer time to get a more accurate result. But why is Verify relevant, right? A lot of people aren't getting tested for STIs because they're embarrassed, because there are cultural norms that make people feel shamed for engaging in sexual activity. And so Verify is saying, you can come to our office or we can come to your home, but we guarantee that the provider you see will be a safe space. And that's a huge change from what's being offered before. We see a lot of different kind of telemedicine or home care delivery programs that are popping up. A lot that Freda already mentioned. Incus Diagnostics is doing incredible things with actually producing test kits in Ghana. So it's not just about accessibility, it's about creating a product locally. Redbird, which Freda talked about, is great. I don't want to echo, those are some of my favorites to talk about because they're doing incredible work. The one thing I will say is, I think another thing that helped us really turn the corner in Ghana for people seeing that health can be taken as a serious startup opportunity is the success of M-Pharma. They've now raised over $55 million US in investment. $55 million US in investment. They're doing incredible things. They've expanded to more and more countries. And they're really kind of paving the way to show that if you have the right infrastructure, if you have the right team, if you build with a sense of purpose, this can be an area for success. I think one of the biggest challenges we're seeing is it can be challenging to collaborate with the government, right? And in a country where so many people are receiving healthcare through a public system, Ghana has the strongest public insurance system in all of West Africa. It's hard often for startups to collaborate and have access to those patients or those clients. We saw this during COVID as well, when so many innovators and entrepreneurs wanted to partner with the government. The challenge is, you know, people get really excited. They want to contribute, they want to participate, but you have to think the government is completely overburdened and there's a higher level of risk in health. If you come with an idea and it doesn't work, and it's, you know, the next Uber, someone's car doesn't arrive on time, okay, we'll try better next time. But if you come with an idea that doesn't work and someone's life is on the line, there's a completely different risk level. So one of the things that we try to do as AHIC is be that intermediary between groups like the government or like large scale international organizations and entrepreneurs to kind of say, okay, we trust these people. We know that they do good work. You should talk to them. And what we also need to be doing is building these systems of conversation in non-emergency times. So we need to be building preparations for the next pandemic before it comes, as opposed to in the middle of it. And it's hard to do. It's hard to focus there when it doesn't feel urgent, but it will set us up for so much more success when a real emergency is present.
That's so interesting. So, you know, thinking about West Africa and the Ebola crisis that came before, and now looking at COVID-19, do you think that there's a learning curve that is being mounted where the next, you know, health crisis, wherever it should come from, and not that we're finished with COVID-19, right? Because Ghana will reopen up its borders and people will come back, and, you know, cases, we don't know where cases would go. But do you think that there's a culture of adherence that's being developed, and you know, really thoughtful planning, you know, despite the like the chaotic situation of this crisis in particular, which has caught everyone off guard everywhere?
Well, I can't speak for the government, but I can definitely speak for some of the stakeholders that I've been interacting with, and from our own context. So, you know, personally, we've been looking at some of the innovations that came out of COVID, some of the policy interventions that came out of COVID, and trying to understand what the implications are for the future. So obviously, for instance, we're talking about health, but in the case of education, for instance, we're finding out that internet data, the cost of data is too high, right? And that affects everyone, for instance. So how do our major mobile operators and the government get together to address this? We now have a new digital finance policy, for instance, that came out during COVID-19. So hopefully, the challenges that came with COVID are forcing us to think more about some of the policies that actually need to be in place to address this. So that's kind of fingers crossed. One other startup that I think is also aligned in this direction in terms of research is Mino Health. And Mino Health focuses mostly on artificial intelligence solutions across various sectors, and currently has, I think, recently received a grant from one of the UK agencies, I forget exactly which one, to do some additional research on the impacts of COVID-19 and how artificial intelligence can be used to further diagnose or identify incidences of COVID-19. So from a research angle, that's positive and something that can definitely be applied for future, hopefully not another pandemic, but future issues and challenges that come our way in the health sector.
Okay.
And I think there's been a lot of research showing that the Ebola crisis in West Africa did help the African continent prepare better for dealing with COVID-19, right? We had already looked at systems of contact tracing, of how to communicate in local languages, of how to do what we call social marketing, which is getting your point across, right? Public health is about convincing people that these things matter. Like Freda said, you can put policies into place, but it's about enforcement. It's about making people feel invested, that we're all in this together, that we're protecting each other. And I think the Ebola crisis, which is still ongoing in parts of the African continent, have helped teach a lot about how to work within existing cultures to make sure that you can get messages out there. I think we're still learning, and there's a long way to go in that. But Ghana just popped up a brand new infectious disease center a couple of weeks ago that they've built in the past few months. This challenge has been significant, but it's also helped us see how we can move things when we have some of that momentum behind it. The trick is making sure that the hardest to reach populations continue to be protected, and that we can continue this momentum and recognize the need for these health challenges, even as things start to feel like they're going back to normal.
Got it. Well, you two are very inspiring. I just want to ask if there's anything that you would like to share with our audience that is maybe outside of Ghana, how they can be involved. Is there anything that they can do to contribute to improving health outcomes, in the region, especially now during COVID-19? Or are there any resources that you would point them to learn more?
Yeah, so in terms of resources, I think, the Ghana government has put up a website, ghanahealthservice.org/COVID-19, where you can kind of get a sense of the current situation in Ghana. And on our website, africanhealthinnovation.org, we've created a COVID-19 page, which really shows not only updates from the president and his speeches and the current situation, but it gives links to conversations about, economic stability, about food security, about access to clean water so people can wash their hands, about all of these other issues that are impacting COVID-19. Because we like to think about PPE, which is really, really important. But if you're asking people to stay home and slow the spread, that's different if your home is a lot of people crowded into a smaller space and you're sharing shower and toilet facilities and cooking space with other families, right? So if you go to our website, you can find out more about that. You can go to the Government of Ghana's website. Social media is a really great way to interact and find out about things that are going on. The last thing that I would say is, you know, the one thing COVID has really done is allowed us to transition more to this virtual space. In Ghana, we love to do things in person. We love to connect one-on-one. And I think that that will continue and will come back. But we have found avenues to do more things virtually, which means whether you're in New York or you're in California or you're in the middle of Ohio, you can find a way to join the conversation, to share expertise with young entrepreneurs, or maybe to learn from experts in Ghana themselves who also have a lot to teach and share with the world. So if you follow us on social media or reach out to us at info@africanhealthinnovation.org, you can find out more. We'd love to have people get involved and stay connected.
Great. Well, thank you so much, you two. It's been a real honor and privilege to hear from you. Emily, congratulations. You mentioned earlier the birth of a baby, so congratulations to you. And Freda, I wish I were with you in Accra and getting a chance to have a socially distanced coffee. But all the vim to you, and I hope you both keep up the great work.